Today's topic really is very important, I think, to all of us, to all women and men also actually. But we're discussing women's reproductive health. Of course, I had the ladies first, but we have Madan Mohit Bhardwaj. He's the founder of Shewings, and he's also an old friend of ours. In fact, he's doing some very good work in the field of menstrual hygiene. Madan Mohit was actually a journalist, and I think part of his, if I can tell your story, or rather you would tell it, he actually was going to the rural areas where he was working with people below the poverty line, and he found out that women actually don't have access to sanitary pads. Some of them use old clothes during those days. Some families even have one panty which they all share amongst them during the months where they need. So this whole awareness and access is something that he and his whole team, the NGO, is doing on ground. So Madan, incredible work. But if you can just tell us about the the levels of awareness and how you're making. I know you're carrying your product also with you, but a bit about how are people becoming more acceptable. Is now we can even talk about sanitary pads. Early on a stage like that, we would not be uttering words like that.
So Priya, We Women Want is one of the best platform to showcase women in various capacities, and this is one of the best panel where you have an amazing gynecologist of the country. Women disposes 380 kilogram of sanitary dispose per year. In a lifetime, imagine the kind of waste we are creating for future generations. We work on, there are two parts of reproductive system. One is the wellness, another one is the cure. See, the cure is being done by here, and we work on wellness. When we thought after working on ground for more than 12 years, we realized that a 12-year-old girl child never uses the same shampoo, same face cream than a 45-year-old mother. Their creams were different. Their lingerie brands were different. As per our studies and surveys, a 13-year or a 12-year-old girl child never take her mother's advice seriously. They have owned their choices.
I think there is no age for that. No daughter will take her mother's advice seriously.
Mother to a 15-year-old, and I can vouch for that.
So we have recently launched India's first minor-friendly sanitary pad. If you could see, this is one of the best product entire world could see, and this is very soon coming on Nykaa and Amazon. And we have created this with 100% viscose. Plastic causes a lot of disease. Doctors know, and everyone we have realized now. We think twice and thrice putting any face cream on our, putting on face, or a lotion or a shampoo. But we never think putting anything, we can randomly put anything in our vagina. This is something we need to think.
That's a very loaded statement.
No, I'm sorry to say, but women need to think that whatever product they are using, this has paraben, this has plastic, and I would say that with lot of research, if you use a non-plastic product or a product which is made of 100% viscose, it might have a wetness, but it would not cause you skin rashes and other disease. I mean, I'm sure Dr. Chaitali must enlighten more things that how plastic and non-plastic things affect your vaginal skin.
So the awareness to using hygienic products or organic products which do not affect the skin of the genital area is very, very important. And the prolonged usage of these products, also the time duration with which you change these products, all this contributes to cancer in a later stage. So it is very, very important, especially from the initial stages of life, to train your body or train yourself to using good organic products, and for only maximum 6 hours or 8 hours after which you need a change. It's very, very important.
Okay. Dr. Parikh, if you can help us understand a bit about, what is the oldest age woman that you have actually been successful with the IVF, and are there any do's and don'ts?
Before we go on to this question, may I just add a little bit?
Please.
I want to sensitize everybody to the role of plastics and what is known as endocrine disrupting chemicals, which we eat, we breathe, gets absorbed from our skin. We've done a very large study at Jaslok Hospital, and what we have shown is that, even your ATM receipt that you carry in your hand will have a very toxic substance called bisphenol A. Not these plastic bottles, but plastic jars, plastic containers, Teflon coated pans, things which we take so much, we use it and just dispense them off.
But Madan, just when you go and talk to people and families about menstruation, you also go to the lower income groups. He does a lot of work over there also. What is the feedback that you get and the acceptance? You must be going to talk only to the women folk, or do you also go to the men folk?
So we talk to initially we used to talk to women in their houses. So men used to be offended that what are they talking to our wife? These are secret things. And in families in Bihar and Chhattisgarh, when we were distributing sanitary pads, there used to be 4 girl and 1 mother in a family, and all those 5 refused to take sanitary pad. They said, bhaiya, hamare yahan par, they told this to their local Anganwadi Karyakarta, that out of these 5 female in a house, only 1 used to wear panty, whoever used to go through cycle. So personal hygiene is not possible without these undergarments. So we started a campaign on undergarments also. We distributed more than 30 lakhs undergarments around the country. One very surprising and shocking information I would reveal here. While bringing this product, we had done a lot of research with teenage schools, teenage girls and gynecologists. One of our gynecologists, who is a very affluent gynecologist in part of South Delhi, she informed that most of their teenage patients, most of the girls, before they enter into college, they are consuming 15 to 20 times contraceptive pills. Imagine the contraceptive pills, young girls of 15, 16, 17, 18, 19-year-old girls are consuming this. So contraceptive pills cannot be an option. It's very, very risky for, the doctors would suggest better. And now what we have, most of these young educated girls pass out from IITs and IIMs, they don't think twice even taking contraceptive pills. They avoid using protection, right? Even men's also feel that, it's not an easy option. They don't get pleasure if they use protection. I'm being very vocal here. While we shall always think, a woman is sufferer here. If you do not use protection, a woman is always sufferer, which harms your reproductive system.
Dr. Trivedi, male infertility also and the use of contraceptives. I would like your view on that.
Yeah. First of all, what he meant by contraceptive pills is the emergency contraceptive pills. The normal contraceptive pills are still fine, and we would still advise the young girls to use them. But the emergency contraceptive pills, which is, marketed as the I pill, majorly known in the youngsters in the market, that is the one which is the root cause of all the problems. They are, the girls don't know and actually it is also marketed in such a way. So they think, okay, every time we have a relation, we just take it. It is every 5 days also they will take it, every 10 days also they will take it. I have had girls come with such huge problems and such irregular periods, and when you go actually into the depth of it, you get to know, okay, they are just popping pills every now and then. So they need to be really educated. While it's advertised in such a way, they still need to know that it is still harmful for the body, and it has to be taken in a particular pattern, and it's an emergency. Emergency happens probably once a year. It doesn't happen every day. That's the most important part, and that is also leading to this most common PCOD problem, and low reserves and irregular periods has come very common. And also after COVID, I am seeing a lot of heavy periods in young girls and irregular periods.
Stress related.
Yeah, it is more stress related, and also I think the virus has caused a little change in the clotting mechanism of the human body. Somewhere it causes excessive blood flow, and somewhere it causes excessive clotting, leading to early heart attacks and stroke problems in younger women and younger patients. So with this erratic behavior happening, OSO pills also have their own contribution to thromboembolic phenomenon or strokes and all these problems. So it has to be taken regularly, and barrier contraception, as in he's mentioned condom, we have the male as well as the female condom also available, which is the best option and the most harmless option in most of the cases, which can be easily used, and that should be promoted in the younger generation as of now.
Okay.